Hey, Sark Centeno, and I had tried to do a Facebook Live on this, but regrettably, I had saved the completed PowerPoint file to the local computer I didn't have access to and not the cloud by accident. And so I told everyone I'd get the full lecture out because we had a lot of people looking forward to this one. So this is 7 deep cervical nerves that make CCI patients miserable. So let's get into this. So we're talking about C1, C2 here, and C1, C2 is an important level because there's a lot of nerves that come through here. Okay, so C1, C2 is designed for rotation. So the good news is those nerves that snake around C1, C2 here are going to be used to rotation. They're going to be designed from scratch to be able to tolerate rotation. The problem is when we start to get instability. And the issue there is that we tend to see abnormal motions like this left to right motion or this front to back motion. And the nerves that snake through here aren't really designed to handle that. So they can get irritated or damaged. So any nerves that are in close relationship to C1, C2, especially those transverse processes, can get irritated by instability at C1, C2. So how do you fix this? You reduce the instability, not rocket science. If that doesn't work, you can also precisely inject platelet growth factors around those nerves. So let's go through the top 7 nerves that seem to cause the most havoc at this area. The biggie that you hear a lot is the vagus nerve. So that's cranial nerve 10. It's involved in problems of swallowing, problems with speech, problems with digestion and gastroparesis or slowed digestion, disruption of the gut-brain axis, tachycardia, which is rapid heart rate, problems with blood pressure, issues with inflammation because it actually connects into the spleen and is involved in the release of various types of white blood cells from the spleen. Chiari area pain or the posterior dura and the cranial fossa and ear canal pain. So lots of things going on with cranial nerve 10. Now, if we look at this, you can see cranial nerve 10 here coming right in front of that C1 or atlas transverse process. So you can see right where it gets irritated. And that's it doesn't take a rocket scientist, again, to see that if you've got C1, C2 instability, you have the potential to get vagus nerve irritation. So cranial nerve 9, glossopharyngeal nerve. This is involved in swallowing, saliva production, throat pain or change in sensation, middle ear pain, taste and sensation at the back of the tongue, changes in blood pressure. And here you can see, unlike the vagus nerve, which was right in front of the C1 transverse process, the cranial nerve 9 is right behind the C1 transverse process. So again, it doesn't take a rocket scientist to see that if you get instability at C1, C2 there, you're going to get, or you can potentially get, irritation of cranial nerve 9, depending on in which direction that instability goes, how that individual person is put together and built. So now let's go to the C2 dorsal root ganglion. This is headaches at the back of the head. It gives contributions to become the greater occipital nerve, and it provides some of the innervation to the lesser occipital nerve. So here we can see that this one lives right behind the C1, C2 facet joint. So if you've got issues at that C1, C2 facet, including swelling there, you can get irritation of that C2 dorsal root ganglion. So this one is huge in headaches. Now let's go to the C1 spinal nerve. Now this is the nerve that innervates the suboccipital muscles that help to stabilize your head on your neck. So if it gets irritated, you can get bobblehead. And this nerve, as you can see, lives right behind C1. So if you have too much C1 instability, this nerve can get irritated, and hence, once it gets irritated, since it supplies muscles, those suboccipital muscles can atrophy. Now we'll go into a super interesting one, the superior cervical sympathetic ganglion. Now, this is involved in dilating your pupils. So some CCI patients have pupils that dilate unevenly, tearing in your eyes, blood pressure and pot symptoms, salivation, your thyroid gland, and even eyelid drooping. And this one lives right in front of the C2 spinous process, as you can see here. So again, if you've got that C2 moving around too much in abnormal ways, this can get irritated and cause those symptoms. Now, the transverse cervical nerve. This is pain, numbness, tingling in the front and side of the neck. And the transverse cervical nerve lives just to the side of that C2 transverse process. So again, abnormal motion there at C2 can cause irritation of this one with symptoms in the front or the side of the neck. And then the greater auricular nerve. This is pain, numbness, tingling in the skin of the ear and mastoid process. And this one, as you can see, again, lives in close approximation to that C2 transverse process. Again, if you've got C2 instability, this one can get irritated, causing issues in the ear. So in summary, there are many deep cervical nerves that can get irritated by excessive motion at C1 and C2. These nerves in CCI patients often make them miserable. Again, there are two ways to treat that. One is to get rid of the instability. That could be through something like that PICL procedure, treating the internal ligaments that stabilize C1, C2, or even direct hydrodissection of these nerves. Hopefully this helps you understand why you're feeling what you're feeling as a CCI patient. Thanks so much for watching. Have a great day. You know what to do. Like, share, comment, subscribe. Thanks so much for watching. Have a great day.